Hi, my name is Erica, and I'm an undergraduate biology student here at WVU. I've been working with Dr. Connie DeLeo, a trauma surgeon at Ruby Memorial Hospital, and a group of researchers investigating the effect of statewide legislation on narcotic prescribing, specifically in the lower extremity orthopedic trauma patient. Opioids are a kind of narcotic commonly prescribed to control pain, whether this is in cancer patients experiencing chronic pain or people who are just out of surgery experiencing intense immediate pain. With this increased use that started in the 1990s and continued to be used more and more over the past 2 decades, we've also seen an increase in abuse, dependence, overdose, and opioid-related deaths. This may be observed in the graph on the right, which demonstrates the number of opioid deaths, specifically in West Virginia, over time. Every year, there are more and more opioid-related deaths. This is something really frightening to think about considering the opioid epidemic and how it's impacted our state. Additionally, West Virginia has the highest rate of opioid-related overdose deaths, with 42.4 per 100,000 people dying from an opioid-related overdose. This is a really upsetting and staggering statistic. Because of this, the Opioid Reduction Act, which was passed into West Virginia law on June 7, 2018, is aimed at reducing the effect of the opioid crisis on West Virginians. This law set restrictions on the amount of medication, number of refills, and duration of supply providers are allowed to prescribe. Additionally, providers must also discuss the inherent risk in taking opioids with patients. This introduces a kind of accountability with the patients as they become more conscious and aware of the risk they are taking in using opioids. Ultimately, our research is seeking to determine the effect of this law on the prescribing practices of opioids in the lower extremity trauma injury population with WVU medicine. We are specifically looking at the orthopedic trauma population because orthopedic surgeons are the third highest prescriber of opioids. Taking all of this into consideration, our hypothesis is that if this law was effective in inhibiting the prescribing of refillable opioid prescriptions in these trauma patients, and the prescription patterns before and after the law was passed were compared, then the amount of prescribed and refilled prescriptions will have decreased after the law was passed in 2018. The way we went about investigating this was we took a population of lower extremity trauma patients from WVU hospitals and divided them into two groups. One which was admitted and released prior to the passing of the Opioid Reduction Act, and another which was admitted following the passing of the Opioid Reduction Act. We then conducted a retrospective chart review where we looked at data collected from both of these populations and recorded a bunch of contextual information, including the classification of the injury, so where was the injury located and what kind of injury was it? Opioid prescriptions within 3 months prior to admission. We recorded the opioids described and the number of refills for that given hospitalization. We recorded if the patient returned to the hospital and under what conditions that visit was. We recorded if the patient requested opioid refills and if that request was granted. We also recorded the age and gender of the patients. Finally, we also conducted a multi-state Board of Pharmacy review where we were able to observe whether patients who were denied access to opioids by their primary provider went to other sources to attempt to obtain opioids. Looking at this data, we conducted t-test and chi-square analysis to compare the data prior to and following the passing of the Act. Now, when we take a look at our results, we haven't completed our analysis or collection of statistical data yet. We are still waiting on pharmacy and statistics to look at this. But ultimately, our results are going to determine whether the Opioid Reduction Act was successful in reducing the amount of opioid prescriptions and refills in West Virginia. Should we receive significant results from our t-test and chi-square analysis, this would indicate a change in prescribing practices. Further analysis will also be conducted in order to demonstrate whether the different demographics discussed in the method section reveal some populations are more at risk than others. This leads us into our discussion and future directions. Should this research reveal a significant difference in the prescribing practices of opioids, this would demonstrate the Opioid Reduction Act is effective. This is significant as it would indicate that the legislation should be maintained and elaborated upon, that the efforts we are making are in the right direction and having a positive impact on our state. However, if the results are not significant, this would indicate that we should be making different efforts to combat the opioid epidemic, that we should not be contributing resources to be invested in enforcing this legislation that is not having a positive impact. Because of this, future efforts should also be made to investigate the different populations that are commonly prescribed opioids to compare the impact of the Opioid Reduction Act on variant groups. Ultimately, we want to make our Opioid Reduction Act as nuanced and effective as possible. We want to be able to address different groups of people and how they are affected independently in order to have a more cohesive and definite course of action moving forward. We want to best benefit our state in the most effective way possible, and this research is serving to demonstrate if the efforts we are currently making are effective in successfully combating the opioid epidemic in West Virginia. Thank you so much for listening. I hope you learned something from this presentation. If you have any questions, I would absolutely love to hear them, but thank you so much and have a great rest of your day.